Good morning, everyone. Thank you for joining us today. Allow me to introduce myself. My name is Georgie Gould, and I am a project assistant at Global Community Resourcing. I am pleased to be today's moderator for today's webinar, the focus of which is social robotics in health and aged care, opportunities and challenges. Today's webinar is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Global Community Resourcing has extensive international linkages, and we have been fortunate enough to work on many international projects and with many research entities. If you have joined us for previous webinars, you'll know that they are designed from feedback and requests we received through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as the development of smart assistive technology in the community care sector. Just a reminder that if you haven't formally registered at the collaborative site, it is accessible to all and free to register. Please note that Global Community Resourcing are not promoting or endorsing any products, research identities or organisations. The purpose of our webinars is to serve and to inform viewers of various smart assistive technologies currently in development and or in deployment. We welcome questions, but I'll let you know that all microphones have been muted. This is in the interest of recording. Your questions can be added to the question panel on the dashboard on the right of your screen. There will be an opportunity for questions to be answered at the end of the session. At previous sessions, we've been inundated with questions, so the earlier you post your questions, the more questions we can respond to. In this webinar, Belinda Ward will take a look at what robots can do and what they're not so good at. Belinda will discuss the results of research into the efficiency of social robotics and application in health and aged care and reflect on her experiences working with Pepper, a social robot from SoftBank Robotics. Belinda Ward is a project manager within the Australian Centre of Robotic Vision at Queensland University of Technology. She leads a project in social robotics using SoftBank's Pepper robot platform to investigate the role of social robotics in influencing human behaviour and how to enhance robotic vision capabilities and help them interact with humans. Welcome, Belinda, and take it away.
Hello, and thank you for that. So yes, my name is Belinda Ward. I'm here at QUT in the ARC Centre of Excellence for Robotic Vision. My background is as a technologist, but I'm going to talk about social robots from a technology perspective, but also hopefully give you a feel for how they can enhance healthcare and potentially enhance aged care. But to give you a perspective on how social robots work, what they can do, and perhaps where our expectations might fall short, or they might fall short of our expectations. So firstly, you might have noticed that the robots are coming. There's quite a lot of social robots in the marketplace. Some of these are quite sophisticated. Some of them are very large and very expensive. I've been working with the Pepper robot, which you'll see on the left of this slide. Pepper is a robot that is manufactured by a Japanese company, SoftBank Robotics, and is now sold internationally. Some of these other robots that have come, and some of them have gone already from the marketplace, some of them have been developed as research platforms. They're very large and quite capable, and then some of them are more commercial products that are much simpler robots. These robots that you can see here range anything from a few $1,000s to a few $100,000. Pepper is a product that is more in the middle of that range, but is a commercially available product. There's actually only a couple of the robots here that are commercially available in the marketplace. But I think this sort of shows that we do have a fascination with humanoid robots and what they can do. Of course, a lot of our fascination with humanoid robots perhaps comes from science fiction. So we have incredibly high expectations of robotics and technology, and we see a well-designed robot like Pepper and suddenly expect it has all sorts of capabilities. But sometimes reality doesn't match our expectations. So there's a picture there of a robot a couple of years ago, which was a security robot. That was supposed to be walking around providing security, monitoring an area, and somehow it slept slipped into the pool. There's also a rumour perhaps that it was pushed. But I think the point is that robots are not as talented and intelligent as perhaps we might expect them to be based on how we'd like them to behave. So firstly, I should talk a little bit about what social robots are and what they aren't. So social robots are designed to interact with humans in a human-like way. So what they aren't designed for is specifically tasks like logistics, so navigation and delivery of objects. That's a field where robotics is being used, but that's not really what social robots are about, and that's not really the type of robots I'm talking about here. But I've shown an example there of some delivery robots that are operating, for example, here in the Sunshine Coast Hospital, delivering meals and picking up trolleys, etc. But that's all happening in the back end of the hospital. Those robots aren't actually going around to people's beds in the hospital. They're doing delivery from the kitchen, through the passageways and into the lifts. And then humans within the hospital are taking those meals and interacting with people. So those robots really aren't interacting with people other than to avoid colliding with them if they come across people in the hallway or they come across people in the lifts. I'm also not talking about robots here which are designed to do physical tasks involving manipulation. That's quite a specific skill for robots, and there are some very sophisticated robots that do manipulative tasks. So for example, robotic surgery, or robot-assisted surgery is happening and it is developing, but that's not the type of robot that we're talking about when we just talk about social robots. I mentioned that people have high expectations of robots, and Pepper, as you've seen, is a quite a good-looking humanoid robot. And one of the things that people see when they see a robot like this is, wow, it must understand. So perhaps I could use a robot like this to do sophisticated tasks like language translation. If I speak to Pepper, maybe I could use this robot to translate languages. But I like to point out to people that this robot is only as good as the state of the art in language translation, and the state of the art in language translation is not yet spectacular. So we could probably point to Google Translate, which can be quite useful to translate between languages if you're a tourist or perhaps trying to get the sense of what's going on in a document. But when you actually press a system like that into service in a medical sense, you might come up with some results that don't quite work for you. So this is a study that was done back in 2014, looking at translating some phrases, some medical phrases to different languages and back via Google Translate. And you can see that there was potentially some errors that you wouldn't really want if you were trying to translate instructions or information from a medical practitioner. If a question was, did your son have high fever at home? And the system comes back and said, your home temperature was high, that doesn't necessarily get across the question that is being asked, and perhaps just adds more confusion. And it's probably important to note that this language translation was all done on a text input, so it was digitally inputted. So if going a step further than that, you were trying to actually speak this aloud, you could see that you could easily chain errors. So not understanding what was said in translating from the speech to the text, and then taking that text and translating it to another language, and then taking that text and using text to speech to say that statement, you can easily have errors, and important information and really important instructions to convey could well be just lost in translation. So it's important to remember that when we're looking at social robots, they look great, they look really intelligent, they may be fantastic to engage with, but they're not doing any better than the state of the art. And in fact, in some cases, they will be below the state of the art in skills like language understanding and language translation. So, okay, with a bit of a caveat like this, what is it that we can use social robots for? And the first thing I would point out is that a robot like Pepper is very cleverly designed to attract attention. And I've seen this working with Pepper. So people love to rush up and interact with this robot. It's got big eyes, it appears to look at you, it's very engaging and exciting, and people want to come up and have some kind of interaction with this robot. So that could well be very useful in a health context. And this is one of the first things that we've done, is looked at how we can capture that novelty by capturing people's attention. So we've tried this out in providing public health information, providing education, teaching people about issues in public health, and also looking at using the robot to elicit feedback. So QUT assisted with a trial of the Pepper robot up in the Townsville Hospital last year. And one of the functions that the robot did there was standing in the hospital foyer, asking people whether they'd had a flu vaccination already that year, and then getting feedback from them about perhaps why they hadn't had a flu vaccination. So this allowed the robot to ask some, or innocently ask some questions and get a response from people because they felt engaged and interested to talk to the robot, that perhaps they might not have answered in the same way if a person had stood there with a clipboard, perhaps recording their responses. So it was an opportunity to test whether people would like to come up and talk to a robot in a public hospital scenario, and then if we could get some feedback and engagement with them. So Pepper asked whether they'd had the flu vaccination, then if they hadn't, went through a series of questions to gauge their attitudes and why they hadn't had that vaccination. So it asked some questions like, did you not get vaccinated because you feel that you're fit and healthy and that you wouldn't get the flu? And it also asked, is it because you are anti-vaccination? And people, you could see, became engaged. Actually, it started conversations between groups of people who came up and engaged with the robot. And we also then asked some information about if they understood how long the flu virus could live outside the human body. And people's different responses of that started to engage them in conversation. They were quite amused if they got the answer wrong, and Pepper corrected them. So it was just a way of testing people's knowledge, giving them some more information, hopefully in a way that they might remember it a little bit more than if they had read it on a sign or a pamphlet. Now, going a bit further, we'd like to see if a robot like Pepper can change people's long-term behaviour. An example in medical clinics and perhaps in nursing homes and in all sorts of other public facilities as well, is of course hand washing, which is still a significant way that disease is spread within these institutions. So even just having Pepper there reminding people to wash their hands is something that we've had a look at. We'd actually like to get even more engaged and link Pepper up and then not just remind people to wash their hands, but take note of whether they have. I think it would be fun to have the robot perhaps chase you down the hallway if you haven't washed your hands and say, come back here, come and do that. But it's about novel ways of engaging people's attention, getting them thinking about health issues, and seeing if that can influence their behaviour. And of course, one of the things that could be very valuable in a healthcare setting, in a hospital, perhaps in an aged care facility, is simply making people feel a bit more comfortable or amused or comforted about the situation. So you can take someone in somewhat of a stressful situation, perhaps have an engagement, and hopefully have them leave feeling a little bit better about the interaction that they've had, that they've met a friendly robot. It is well designed to look friendly and innocent, but hopefully a little bit helpful and cheerful as well. So we've also looked at using Pepper to, and when I say Pepper, we've used Pepper because it's the robot we're working with, but it could be a future social robot. I'm not only saying that it's something this robot could do, it's potentially something that future robots could do. We've looked at using this robot as an assessment tool in clinical practice. And where I say that, the robot, of course, is not making any diagnosis, but it's being used as that tool when you come into a health clinic to go through an assessment of your lifestyle and your behaviours. So asking, you know, how often do you drink alcohol? How much do you exercise? And potentially some questions around mental health as well. So these are opportunities to sit down and have that initial contact where you're providing some initial information with a friendly face again. And then in the trial that we've done in the QUT Health Clinic, the visitors come in, answer a series of questions with the robot, and then that system is is given to them as a printout, which they collect from the corner of the room and take that and then go and see the medical professional. So it's seeing how the robot can help in the context of a clinical practice, and does it make sense there? And we had really positive engagement, quite positive engagement from a lot of older people that came and visited, and they felt that the robot provided value as part of that experience of going along to the medical clinic. Now, we're really interested then is, can we take this a little bit further and perform some basic assessments to people if we talk about some of the behaviours that might be problematic for them. So we've got the robot set up so that it can do a questionnaire like the K10 scale for anxiety and depression, and just talk people through those questions. Again, the importance of having a robot perhaps ask these questions here is it's an opportunity for people to give hopefully fairly honest answers and not feel that they're being judged on this, perhaps in the way that they might feel if they were responding to a human. We've put together some scales on stress and then also gone through some well-developed scales and applied them to the robot to ask people about things like their gambling behaviour, ask people questions about their alcohol usage, and perhaps things like anger management, because these are all scenarios where we think if someone sits down in a quiet environment and has a discussion with a robot, that they might be more inclined to answer these questions of a robot than they might of a person. Now, moving on from there, of course, using a robot in assessment is one thing, but can we use a robot in treatment? Can it be useful in helping people through a situation? So we've had some trials here at the university with having students sit down with the robot and go through a problem-solving exercise, and our initial results show that some people responded very positively to that. They liked the idea of talking through an issue, and in this case it was things that concern them at university, like procrastination, for example, that they felt that they got some value of sitting down and verbalizing that problem in a discussion with a robot. We've also looked at whether the robot can provide some more coaching techniques, so some wellness, centeredness, breathing techniques to people. And again, we've had a positive response from a lot of users that have been part of that trial. So we're now really interested in working with the health practitioners to see where we can take it from here. How can a robot like Pepper or future social robots be involved in coaching therapy in a healthcare scenario, or perhaps it might be in a scenario where you're helping staff through a stressful situation, or just getting people to provide feedback about what they're feeling, how they're coping, and gauge that mood and perhaps help boost it if people feel that they've been able to open up and have a conversation. So of course, trying things out and actually determining whether it's effective and it has worked, you know, the next step is to test whether these robot interventions can be helpful. So Dr. Nicole Robinson, who works in the group here at QUT, has a background in psychology, and she has recently published a review of the health interventions that have been conducted by social robots, and those that research which has done randomized controlled trials. So she found through an extensive survey of the literature 27 trials that people had done. A number of these were in child health and well-being. Particularly, people have focused on children with autism spectrum disorder, because I think that's an area where people have recognised early that robots may well offer some assistance. And there's also been a number of trials with older adults. But what hadn't really been done at this point was trials on adolescents, young adults, and other problem areas other than sort of perhaps children with learning issues and more elderly people, particularly with cognitive issues. So it hasn't really been tested how effective using a social robot could be, for example, on adolescent mental health, whether it can be useful in that area. Also, a lot of these studies were fairly constrained in what the robot did. They weren't spontaneous, they really weren't spontaneous conversations. They were very scripted. The robot was only, you know, going through a very standard process. So we'd really like to see how improved the results could be if you can let the conversation be a little bit more natural. The trials so far have used actually a variety of robots. The Now robot that I have pictured there is quite common. It's a robot that's been around for perhaps almost 10 years now, and in a sense it's the precursor to Pepper. So it's sort of the first generation of these social robots, if you see a robot like Pepper, which is perhaps the second generation. In some of the trials with older adults, they've used robots like the Paro Seal, which is really designed to provide some comfort and interaction for people that are developing dementia. And there's also been a number of other smaller robots that have been used in these trials. I guess one of the things that hasn't really been proven from these trials is how long-term any of the effects are. It's fine to get someone giving a positive interaction from a brief positive response to a brief interaction with a robot. But what we're really interested in now is, can we get longer-term effects from this? And so far, the trials have really only been small. It's technology that's in its infancy, and they haven't necessarily had longer-term follow-up outcomes. Interestingly, though, all the trials did come back with positive outcomes from robotic interventions. But again, it's not always clear from those trials whether the positive outcomes were a result of the excitement and enthusiasm to try out something new, and whether that could, in a longer term, have a positive effect in healthcare using these robots. So there's still really a lot of work to be done, and we're interested in collaborating with people in healthcare and in aged care who have ideas for how these robots might help in their care scenarios, and how we can test that to really see if, firstly, if it's technically feasible. Secondly, if people really can work around that, can they bring the robot into a practice? And then, of course, ultimately, is it adding long-term value? And so far, of course, I have just talked about scenarios where people are interacting with the robot as it stands in front of them. But one of the advantages of robots, of course, is that they can move around, and Pepper has some very nicely designed wheels, so it can move around. So there's no reason that we couldn't then take these discussions, these conversations, and have it in a moving context, have it in a context where a robot, for example, comes to a room in a nursing home and engages in a conversation, or goes to a hospital bed and engages someone in a conversation. When I say there's no reason to, of course, actually having a robot confidently move around is, from a technology perspective, again, something that's a little bit harder than it might first appear to be. So I will show, hopefully, a video here of Pepper moving around the lab, and my technology has failed me. Here we go. So this is Pepper navigating the laboratory here at QUT, which all looks very nice when you have a robot autonomously finding its way around. But this is a very constrained scenario, and what we've actually done to get the robot moving like this is go through and carefully map the area. So it's been mapped with a laser scanner, which has built up a really good model of the floor that the robot is moving around, and then that map has been loaded into the robot, and then the robot is able to somewhat confidently navigate its way around the floor. But that's not a scenario that you would like to have in a medical centre. You perhaps don't want to get a robot and then have to get a bunch of robotics experts to come in and build a map of your building and then load that onto the robot and then program the robot to move around. This video, if I can show, is not running, of the robot moving around. What this shows is the map that has been loaded into the robot. So it's got a sense of where it can see walls and doorways and furniture. And then the robot uses the depth sensor that it has to work out where it is in that space and navigate around. And that's the traditional way of doing navigation for indoor robots. But it's not something that is terribly accurate on a relatively cheap robot like Pepper, and it's also just not at all intuitive. As I mentioned, you don't really want to have to bring in a robotics expert to get your robot to navigate around a building. It's also not very robust to movement, so if the furniture, beds, chairs, tables, etc. gets moved around enough, or the space gets reconfigured enough, suddenly the map that you have is no longer relevant, and you have to go through the whole exercise of remapping an area and getting the robot moving again. So one of the things that we've been doing here is teaching then the robot to navigate more in the way that a human would, where it uses robotic vision to move around. But more importantly, this is a technique that allows potentially a robot out of the box to have someone lead that robot around. And what we're doing is leading the robot around by the hand and showing it around. So in a sense, this could be a non-robotics expert saying, well, hello, I've got my new social robot. I will lead the robot around, show it where it can go, where it can't go, identify the different rooms that you might need to navigate to, in a similar way to the way that you might take a human around a new facility. You'll show them look, here's the kitchen, and if we go this way, this is how you get to the bathroom. These are the offices or the rooms down the hallway. So showing a robot around in an intuitive way that you might do to a human, as the robot moves around there, it's recording the vision of the area. And then thereafter, it can find its way back to the places that you showed it. Now, this is something that we have working in the laboratory situation, but it's really quite a long way from the kind of thing that you could roll out into a new facility. So although robots that are mobile really give the impression that it would be an easy task to roll them out in a health clinic and have the robot show you around, or in an aged care facility and show you around, or even to get a robot out into your house and have it navigate around with you. The reality is that there's still quite a step to have these robots up and mobile and interacting, if you like. So we're still at the stage where the robots can walk and they can talk, but they can only do things at a fairly basic level, and so far they don't do them terribly well together. So that is a bit of a caution, I guess, about social robots. They look great, they're very engaging. We've seen people very interested in what robots can do. And I think if we're careful about the scenarios in which they're presented and we're not setting false expectations, I think there are some great applications for robots in healthcare, and potentially as concierge type applications, helping people to come in and feel good about a visit, collecting feedback from people, some entertainment and motivational applications, I think could be really great. And ultimately, robotics is moving, the technology is moving fast. We'd like to see these robots moving around in facilities and interacting with us in a more natural sense. But they're not quite at that stage yet, but the technology is developing. So we're really interested at QUT here in working with groups that have an application scenario and are prepared to put some work into developing those ideas and looking at what technology can and can't achieve in those situations, and really trying to motivate the future development of these robots, and what are really the critical features that they should have, and how can they be used and accepted in healthcare and in aged care. I'll hand back to Georgie now. Happy to answer any questions.
Thanks, Belinda. I do have a few questions from the collaborative. Daniel asks, often people have the fear of robots will replace the current workforce. Do you have any comments on this?
Sure. Look, it's something that people tend to be fearful of right up until they have seen and interacted with a robot. It was certainly something that people were worried about when we started talking about the deployment in the Townsville Hospital. But then when people got an experience of how this robot did work and how it could interact, people did get a sense that certainly it doesn't have the type of capabilities that a human has in any sense, either physically or socially. So they could really see that the robot is being used for a small subset of things that really, in a sense, is freeing up a person to do the job that they are more capable of doing, giving them some more time. So when we had Pepper acting as a concierge outside the short stay emergency ward in Townsville, the robot was actually there answering the questions that the nursing staff had told us that were the things that people tended to rush up to them with. And they were questions like, where do I get back to the car park? How do I pay for parking? Where can I get a coffee? Where can I go for a smoke, potentially? And those were the kind of questions that really you don't need your qualified nursing staff to explain how you pay for the car parking, but the robot can answer those questions. So that then is hopefully freeing time for the the healthcare staff to do what they're good at, which is provide the healthcare. So I think people have this fear that a robot is going to do all these things, but once they understand that perhaps a robot is not as it's portrayed in science fiction and totally capable of taking over from a human, they are less fearful about that.
Thanks, Belinda. The next question comes from Cara. Are there other examples of assistive technologies like Pepper that are currently being used, or they are still in development, that we can learn lessons from, that you know of?
So there are, on that earlier slide I showed with other examples of social robots, there is the cruiser robot from a company called Ubitech, and Queensland Health actually currently has a couple of those robots which they are trying out as well. So in a sense it's similar to Pepper, although it doesn't look quite like Pepper, but it's a mobile robot that is being used or trialled at least in a health context. And I'm not evangelizing one type of robot over another. I guess they have similar features that you might expect, in that they can speak, obviously, they can make some arm gestures. They're not really designed to do manipulation. They can respond to spoken voice. And having said that, their speech recognition is not 100% accurate, but they have capacity to hear spoken voice and make some kind of response. They also have other input methods like a touch screen. They can move around. So yes, there are robots that are out there. They're really almost in prototype stage in terms of the applications. As I said, they do similar things. We have seen quite sophisticated robots be built and then be discontinued, I guess, where they didn't have necessarily developed a strong market presence. The uptake wasn't really happening. They were almost built as a bit of a technology novelty, but I think social robots now have perhaps reached the tipping point where they're here to stay. Pepper is definitely a very attractive robot. The novelty does well. For some people, the novelty really hasn't worn off yet. People still find themselves responding to the robot. So I think as long as the behaviours that the robot has are evolving, people really do want to interact with these robots. But from a technology perspective, I would caution people to think about what problem they're really interested in solving with this robot before they invest too much in a technology that might not go forward. But I think in many cases there is a case for investing in social robots.
And on the back of that question, Chris asked, where can people access the results of the trials that have been mentioned in today's webinar?
So these trials are actually being published in a series of journal and conference publications, which I will make sure that they are listed on our website as they come up. So that's the Robotic Vision website, which I can put a link to at the bottom of this presentation.
That'll be great, and we can share that through the collaborative as well. Yep. We have one more question from Julia, asking, where do you see assistive technology development being in 10 years' time?
Well, that's look, one of the promise of artificial intelligence has always been that it's 10 years away, and artificial intelligence has been 10 years away for probably 60 years. Look, I do expect that we will see more robots and things that look like companion robots in probably in sort of major health clinics. I think that they will be used in education and perhaps in health education, and they will become more accepted in society. I think they will be used for helping perhaps people interact with healthcare and aged care services. So it's really a perhaps trying to develop a sort of friendlier and more intuitive interface to health services. Physically assistive technologies are, again, another big step, but I can see sort of future robots, for example, helping patients navigate a facility, for getting people up and walking around. I think providing some physical support in an intelligent way. So rather than just giving someone a walking frame or something to hold on to, a robot could be assistive in that sense. So perhaps helping in rehabilitation type exercises, I can see them being used. Perhaps with people in that are developing dementia that have a habit of going walking and getting lost in a facility. I can see a robot that is helpful in guiding them around, or preventing them from going somewhere that might be dangerous, guiding them back. And I can see someone going and happily having a chat to a robot that's walking around with them in a facility. But I can't really see the future.
The big question to answer.
Yeah.
Thank you for your time, Belinda, and thank you for taking the time to answer those questions from the collaborative. If you have any further questions about today's webinar, please email sat@communityresourcing.com.au. So what's next for the collaborative? The Redland Chamber of Commerce will be hosting a business breakfast event focusing on medical Internet of Things and the future of healthcare. The event will be held on Wednesday, the 16th of October at My Horizon in Capalaba. The event will feature several speakers, including the chair of the Aged Care Industry Information Technology Council, Dr. George Mangelis, and chair of the Community Care Smart Assistive Technology Collaborative, Anne Livingston. The presentation will focus on the role of innovation and technology is playing in the delivery of contemporary health, age and community care. More information can be found on www.satcommunity.com.au. On the 23rd of October, we are hosting an event, Summer is Coming, Prepare for the Heat, with the Savvy Senior Network on Macleay Island, focusing on heat waves. Heat waves are increasingly intensing in frequency, and heat waves season is among us. The event will focus on innovative heat wave intervention and how they can and will be utilised to improve the health of vulnerable population in the island communities during times of heat waves. For more information, visit www.satcommunity.com.au. We have a range of upcoming webinars over the next couple of months focusing on topics such as smart mobility, smart homes, and senior entrepreneurs. Watch the Community Care Smart Assistive Technology Collaborative news space for more information on these webinars. If you haven't already done so, please go online and register for the collaborative. You'll be able to access today's presentation and have the opportunity to ask future questions. Please check the collaborative for more information on upcoming events. If you have any further questions or inquiries, please email us at sat@communityresourcing.com.au. Once again, I would like to thank the members of the collaborative research team and today's speaker, Belinda Ward. Thank you everyone for attending today's session.